So amino glycoside, this is the antibiotic we use for any kind of bacterial infection, right? Amino glycoside, we said. The most common aminoglycoside we use, gentamicin, most commonly we use in hospital for any kind of serious bacterial infection. Bacterial infection, I said. Other aminoglycoside are used called tobramycin, amikacin, neomycin, gentamicin, vancomycin, or streptomycin, right? Streptomycin also we use for anti-TB medication, anti-tuberculin medication, or anti-TB. So, as I told you, that if your patient has any bacterial infection like infective endocarditis, means the infection occur in the heart valves, endocarditis, or if your patient has a meningitis, means the infection or inflammation of the meninges in the brain, meninges. So if your patient has a meningitis or infective endocarditis, or if your patient has a very bad blood infection, it's called septicemia, right? If it untreated, the bacterial infection is spread all over the body through the blood and causes different organ damage. Okay, so if your patient has a septicemia, if your patient has a infective endocarditis, if your patient has a meningitis, we give them aminoglycoside like vancomycin, gentamicin, or amikacin, or neomycin. As a shortly saying, any kind of serious bacterial infection, we give them aminoglycoside. Basically, aminoglycoside like gentamicin or vancomycin or neomycin, they destroy bacteria by inhibiting protein synthesis of bacteria. But when you give aminoglycoside to your patient, like gentamicin or vancomycin or streptomycin, there are a lot of side effects. You have to educate your patient, or you have to make awareness to patient about the side effect. If they know about the side effect, it would be easy for them to adapt with the medical condition. Otherwise, they will be panic, right? So the side effect of aminoglycoside, they causes ototoxicity, they causes nephrotoxicity, and they causes neurotoxicity like vertigo or ataxia. As I told you, the aminoglycoside causes the ear infection. It is called ototoxicity, or they cause renal damage or nephrotoxicity. So effect on, when you give this medication to the patient, you have to monitor for any kind of hearing problem like ringing in the ear or dizziness. Keep in mind, this aminoglycoside do not give during the pregnancy. So pregnancy, the contraindication of aminoglycoside, also tetracycline. During pregnancy, no aminoglycoside, no tetracycline, right? If you give your patient aminoglycoside like vancomycin or gentamicin, you have to check the blood level of aminoglycoside or blood level of gentamicin. So you have to draw a peak and trough level by blood test. If you draw the peak 30 minutes after giving the medication, if the route was IV, intravenous, you can draw the peak 1 hour after if your route was orally. You can draw the trough level 30 minutes before the final dose, right? I want to recap something. If you give aminoglycoside to your patient, we have to monitor the patient for tinnitus and hearing loss. Also monitor the kidney function, right? Means you have to check the creatinine level, input output chart, and also observe urine for hematuria. Hematuria means blood in urine, right? Also admin intravenous, intramuscular or intravenous, monitoring the peak and trough blood level, right? If you say your patient has an overdose of aminoglycoside, we give them antidote. What are the antidote of aminoglycoside, or what are the antidote of vancomycin or erythromycin or gentamicin? Only one, and this is called calcium gluconate. So calcium gluconate are the antidote of aminoglycoside.